before I jump in and teach you how to verify Medicare, I wanted to show you exactly what the card looks like and give you a little background on what kind of patients will be coming in with this specific insurance. And then I will teach you how to verify Medicare and its eligibility and benefits as well. So first off, Medicare, the card looks exactly like this. It's red, white, and blue. That's a lot of times how I explain it to the patient if they're confused on what I'm looking for. I'll say, I need your red, white, and blue Medicare card, and a lot of times they know exactly what I'm talking about. Medicare is a federal program that applies to patients that are over the age of 65. However, patients can have Medicare. They're under the age of 65. Some patients you'll see come in with a disability, or some have a certain medical condition that allow them to qualify for Medicare, such as those on renal dialysis. The way I think of Medicare is you think of care, caring for your elderly, caring for your disabled, caring. So that's how I would look at it. So this is the card that you will see. It says the patient's name, and you have to make sure that the patient's ID and their name match, then the Medicare claim number. So this, more often than not, will be a patient's social security number or a patient's spouse's social security number. So as long as you have this card, you know that the patient has this insurance, and then it will have a letter on the end. So this letter can vary. There's like 12 different letters that could be on the end. Most of the time you will see the A, which denotes the primary claimant and who's retired and has paid into Medicare. Sometimes you'll see a D, which the social security number will be the patient's spouse, and then the D stands for deceased. So the spouse is deceased, but the patient is under their spouse's Medicare. And then there's a few other options. Sometimes you'll see a T or a C. The C is for a child. Those are the main ones that you'll come across. If you ever have any questions on if we accept it or not, definitely ask us. And then at the bottom it says is entitled to hospital and medical. So the only one that we have to have in order for the patient to be seen is Part B. If they have Part A also, that's fine, but we have to have Part B for the patient to be seen in our facility. We're not a hospital. We would be filed under medical, so we have to have the Part B. And then if they just come in and just have Part A, they do not have Part B, we are unable to accept this insurance, just so you know. And then also I wanted to let you know, whenever verifying Medicare, whenever you pull it up on their insurance, they always have a $183 deductible. So after that $183 has been met, then they have 20% coinsurance. So that is for every Medicare patient that comes in with this red, white, and blue card, they will have a $183 deductible. Once it's been met, they will only pay 20% coinsurance. So this means their insurance, Medicare, is paying 80% of their office visit, and then they have to pay 20%. So if you do the math, say the patient's office visit is $100 and they have 20% coinsurance, they would pay $20 before they left. This is for all Medicare patients. Again, we have to take 20% for these. A lot of patients have a supplemental plan, which I will show you in a later video, but I just wanted to give you the basics on what Medicare looks like and who uses it, and how to verify Medicare and its eligibility and benefits will be in the next slide. Now that I've showed you what Medicare looks like, I would like to show you how to verify it on Instamed. So you'll come to the Instamed verification website and you put in your user ID, password, and the corporate ID, which is Emergency MD. Hit login. And it will bring you to the home screen right here. So you'll come over, click Healthcare, look under eligibility, and we're going to verify eligibility. So under the health plan, for this one, I want you to be aware that Medicare, you can't just type in Medicare. You have to type in the state as well. So of South Carolina. Maybe the patient's from Texas. That's fine. But we're verifying it in South Carolina. So you always, anytime you're verifying Medicare, want to make sure that you choose Medicare of South Carolina. You can hit enter. It will pop up, or click on it, and it will pop this up right here. So for this, I'm always going to reiterate that you want to fill in all of the fields that have the star. If you don't, say you just put in Jane Doe and you hit submit, it'll ask you for some more information. So you always want to fill in all of the asterisks. Okay, this next insurance verification will be about Medicare. So you'll look under the healthcare tab, eligibility, verify eligibility, and under here, you'll type Medicare of South Carolina. Okay, and so for this, it's a little bit different. You'll have to fill in a few more fields. You'll have to put in the patient's first name and last name and their date of birth. And then you'll have to put in their subscriber ID. So the Medicare card, it's a red, white, and blue card. You want to make sure that it has Part A and Part B. So we have to have both of them in order for the patient to be seen. If they just have Part A, then we can't see them. That's just for the hospital. So again, you have to have both Part A and B, and then you'll type in the patient's subscriber ID, and this is more often than not their social security number. And you'll hit submit. Okay, and so it'll pop up. So it says active coverage. You can see all the information on the side here. And then Medicare, you'll want to know if the patient just has Medicare, they don't have a supplemental plan or any secondary insurance, you'll need to know if they've met their deductible or not. It's only $183 after they've met that, which it looks like this patient has. They'll have a 20% co-insurance, so they'll pay 20% of whatever is done before they leave. And then you can hit show details, scroll down, you can find professional office visit. Okay, and it just says active coverage. Let's see if we can find any more information. Usually up here at the top, it will say individual. So their health benefit plan coverage, so just the general. So it'll say 20% co-insurance for Part B, and then the deductible's been met. You can also come over here to the legacy response, scroll down, click on professional office visit, and you can see the same thing we saw on the other page. So that is the basics on how to verify Medicare.